Solutions. And Pete is going to talk to us about various insurance options, focusing on Medicare and Medicaid, I believe, too. So Pete's been with us many years. He can meet with you individually starting October to discuss your individual needs, which would be great. But today he's going to talk to us more in general and let you know what changes are taking place. Pete?
All right.
Do you want this in here?
Yeah, we can put it in there.
Off while I do that.
I'm a pretty loud speaker anyway, but we can use it if we need to.
There you go.
What is this little guy? Oh, is it? Okay, gotcha. Very good. Hello, everyone. How's everybody doing? All right. Lovely talk on Medicare. I'll give you that talk today a little bit. Let you know what's going on with Medicare for this year. A little bit some changes. What's coming up for next year. Now, we can't talk about plan benefits because that's specific to October 1st. We can't talk about actual plans, but I'll give you some ideas on some things that are changing.
So October 15th.
October 1st, actually.
Oh, okay.
Yeah, if you call after October 1st, we can talk about all the plan benefits. If you have a plan, we can compare options and things like that. So, but a little pop quiz, because I brought an umbrella today. If anybody can answer a pop quiz question, you have to raise your hand. So I'll call on you. But does anybody know when Medicare started? Now, before you answer that, Social Security started when? 1935. If you want to raise your hand, if you know the answer, when do you think Medicare started? Anybody know?
30 years later.
What's your name, Michael? Is it Michael?
1942.
1942. That's not it. How about you in the back? What's that?
Oh, no, I don't know.
I said Roosevelt. I don't know the date.
What year did Medicare start?
Say 1965, maybe.
1965. You're right. 1965. You're absolutely right. Do you need an umbrella?
Yeah.
All right. There you go.
How ugly is it?
That's compliments of United Healthcare.
Oh, it's not that ugly.
So Medicare did start in 1965, and the first person on Medicare was actually Harry Truman. Interesting enough, you know how old Harry Truman was when he got Medicare?
65.
You would think he was actually 81 years old when he got Medicare. 81 years old. So I'd say that's probably the oldest person that got Medicare.
Now, next question is, how much did Medicare cost at that time in 1965?
That is a great question. We may have to ask Google for that one. So, and then in 1972, that was interesting. That's when it was expanded to people who are disabled to get Medicare for disability. So I think that was a great addition. So there's a lot of years that things gotten better with Medicare. So the reason I mentioned that early on, and I'm mentioning those dates, is that there's a lot of different changes come up with Medicare. And I'm going to tell you about some of those that are happening. Some are the biggest changes I've ever seen with Medicare has to do with the drug coverage for some people. So, but we all know there's 4 parts of Medicare, right?
No.
No?
Yeah.
You got your A, which is your Medicare Part A is your hospital. You got your Part B, which is your medical, and that's provided by Medicare. Medicare provides that to you when you're eligible for it, being disabled for 2 years or turning 65, right? You have your Part C plan, what some people call Medicare Advantage. That's Part C. That has your A, B, and D in one plan. You also have Part D, which is the drug coverage, right? What's the other part of Medicare we didn't mention, though? Is there another part besides A, B, C, and D? Anybody know?
No.
Gary?
Medicare supplement plans, commonly known as Plan F or Plan G. Those are the supplement plans. So it's not a part of Medicare. It's a Medicare supplement and it's a plan. Yeah, I can. So I'm going to talk a little bit about those and what some changes will be coming up. But those are the main parts of Medicare. The annual enrollment period that comes up for October, it's actually October 15th to December 7th. But you can start talking about plans on October 1st. That is primarily for Medicare Advantage, Part C, and the drug coverage. You can make those changes that time of year. If you make that change during that time period, it's effective January 1st. Okay. If you have a Medicare Advantage on January 1st, you actually have an additional 3 months to make another change if you wanted to, if you made a mistake or change plans and it wasn't the right decision. Or the network change. You ever heard about a networking change with an insurance company? It does happen, right? So we'll talk about that in a minute. I think there's a problem with Humana right now. And their network.
Talk about that.
So a couple things happened in 2023. One of the biggest thing is if anybody's on Medicaid and Medicare or just straight Medicaid, you had to do your redetermination this year. You had to update your income or you'll lose Medicaid. So if anybody's on Medicaid or Medicaid with Medicare, you do have to update your income or you'll lose Medicaid. It's really important. Usually call the Connect office or the Medicare office. Sometimes SHIP will help you if you need assistance. There's a SHIP office in Lexington. You can call them. It's legal aid of the Bluegrass.
Or you could call the IRS.
Maybe. I doubt that.
They will do your taxes and tell you.
So you definitely want to do your Medicaid redetermination so you can keep your Medicaid active. If you don't have that, it's going to make a huge difference on your medical costs.
So they send you a letter.
Yeah, most of the time they're going to send you a letter and you can fill out the form too, possibly, and just return the letter back to them. So you can just return a letter, make a phone call. You definitely want to update those things. It's a big deal as far as your cost.
Updated every year
Yep.
through IRS and Social Security.
Then your other addition in 2023 is they had insulin reduction in 22, but they made more reductions on insulin in 23. So if you're getting insulin, you should be paying $35 or less if you're a diabetic insulin. Okay. Vaccines were reduced or made free. Shingles wasn't a free vaccine. Now it's a free vaccine. So if you go somewhere and you're getting your flu shot, your shingles, I think tetanus, maybe hepatitis, all these vaccines are out there. If you want those, they should be free. If you ever find out they're being charged for it, maybe you're using the wrong plan. Maybe it's not Part D. Maybe you got to use your supplements. Find out, give them which card they need to have. Is it covered by this one or this one? Ask them. Because I think the shingles is Part D, but then the flu shot might be your supplement. If you have a Medicare Advantage, it's all in one. You don't have to show them any other card. So keep that in mind.
My flu shot's free.
It should be. Absolutely. Absolutely.
And my COVID shot. They say free COVID shots this year.
Yes, absolutely. So 2024 is the Inflation Reduction Act. I don't know if anybody's heard about that, but the Inflation Reduction Act is going to have the largest change ever in the Part D area of your Medicare. So for the first time ever, there's going to be a max amount of pocket on prescriptions. So obviously, if you got Medicaid and Medicare, your prescriptions are already reduced. But if you don't have Medicaid or extra help, now you're going to have a max amount of pocket on prescriptions.
Did they stop Medicaid in Kentucky?
No, Medicaid's still available. Yeah.
Oh, I didn't know it.
What's that?
What's the maximum?
So here's the interesting thing. He asked me, what's the maximum going to be on drug coverage? Well, next year it's going to be $2,000. Not next year, but 2025 it's going to be $2,000. It's going to be very, very clear. That's your max amount of pocket. This year, it's not clear. When you get your book from your company, it's going to say the coverage gap max amount of pocket is $8,000, but that's not your cost. What they do in your coverage gap section is if you hit the coverage gap because you have high expense, you pay 25%, but they use the full cost of the medication for the $8,000. So I looked it up online at the Kaiser Family Foundation, and they said the estimated max amount of pocket is going to be $3,333. So that's going to be your max amount of pocket. It should be about that amount because you're paying 25% in the coverage gap. The plan is picking up 5%, and then the manufacturer's picking up 70%. So the full cost goes towards that $8,000. So it's really not $8,000. But I talked to a gentleman yesterday. He's an attorney. He was just coming in to meet with his on his Medicare. And I'll say, you read everything, don't you? Because you're an attorney. He goes, yeah. I said, well, look at this. What do you think? And he's reading it and says, doesn't that seem confusing? Let me explain actually how that works. And I explained it to him.
You had to explain it to him.
Yeah. And it's not clear, but hopefully in 2025, it's even more clear that your max amount of pocket is $2,000. Okay. And if you spend that kind of money, you're done for the year. Here's another cool thing about 2025. If you know you're going to hit the max amount of pocket, you can pay that over a 12-month period, that $2,000. You don't have to pay it all for the first 6 months and then pay zero for the next 6 months. You can take that $2,000 and spread it over the 12 months. So you're not paying a lot up front. Because I know some people that have a deductible on their drug plan, they got to pay that large deductible in January every year. So this year was $505. Next year, if you get a brand name that has a deductible, it's $545. Okay. So there's some changes, and a lot of people think it's the drug plan. It's not always the drug plan. It's Medicare raised the deductible, and the drug plan is going to adopt that change. So a lot of people call me and says, "Hey Pete, this deductible went up a lot on this company. What's other companies doing?" Well, they're all about doing the same thing. Okay. Unless you have a high premium drug plan, you could have a zero deductible. Or if you have a Medicare Advantage plan, you could have a zero deductible on your prescriptions. But there are a lot of drug plans today that if you get a very low premium plan, there's some out there that are $10 or less, $20 or less, and they're going to have the large deductible first if you get a brand name. Then you get that brand name with a copay or co-insurance. Now, one of the plans I noticed for next year, without giving you too much detail, one of the plans I noticed has lowered their premium, which is great, but the co-insurance, there's not a copay on the brand name anymore. It's now a co-insurance. So let's say if you got a brand name, you pay the deductible, and now your copay is $44 for that brand name. Well, that's great. But now this plan that I'm thinking about is changing their copay from 44 to 25%. It's a big difference. If your drug is $500 drug, instead of being $44, now you're paying $125 if it's 25%, right? So you got to be careful and check your drug plan. Now, you can do that through our office. If you are a client of ours, or if you want to become a client of ours, you can call Medicare, go on Medicare's website, or you can call the SHIP office here in Lexington. Any of those avenues can help you with your drug plan. And it's a good idea to really check those. Now, if you're on Medicaid and you get extra help, all those prescriptions will usually be zero. Now, you have a question with your hand
I
raised?
do.
Okay.
I was at a podiatrist the other week, and she said, you shouldn't have she says Medicare is the best, and you shouldn't have an Advantage plan because you don't get as much. And to me, that was strange.
I think that might be a little bit not as educated, because Advantage plans do provide sometimes more benefits. If it's the right plan for you, it's the right plan for you. I don't work with Medicare Advantage with someone because their friend has it. I work with that Medicare Advantage because it's a good product for that person.
Yeah.
It needs to be right for each person. So did you say anything to her about that?
Oh, goodness. We had the worst communication problem I've ever had. Any person. But because every sentence I said, she misunderstood.
Oh, wow. Oh, wow.
That was strange. But it had to do with diabetic shoes. You know, people who are diabetic can get customized shoes. I think it's once a year, maybe. I don't know.
There's some plans will provide that at no cost. By the way, since you brought that up real quick, I'll get your second question in 1 second. There's going to be a diabetic plan for people who are on Marketplace like Connect. There's also going to be a diabetic plan for people on Medicare Advantage plans. So be on the lookout for that.
I wish that they would have a preventive plan, like, you know, they have that where it reads your blood sugar on your arm.
They do have that with certain plans. It's free with certain plans.
Is it really?
It is. You have to look for the right plan though for that. Yeah, they are free.
Not getting mine once a year.
Yeah.
It makes sense
Yeah,
to
absolutely.
do that
Now, you had a question up here in the front, Charles?
Yes, my question is, when will you guys know? I know Social Security is under this reduction plan, is trying to negotiate for the top 10 high paid drugs to lower the cost on that. When will you guys know about that?
So that program is tabled to next year, 2025.
Yeah, but when will you know?
Not till 2020.
2025 is when that releases. So I would say next year, this time in
Okay.
2024, like we do this update, we'll know what it's going to be for 25.
Okay,
Yeah,
so
that's actually
don't-
part of my conversation. So thanks for bringing it up. That's good.
Don't really expect any big news in the end of this year.
No, I think the biggest reduction you're going to have is that max amount of pocket. If you take Jardiance, if you take
Yeah,
Xarelto, if you hit that max amount of pocket, that $3,300 I mentioned, then you'll pay zero the rest of the year. 3,300.
Yeah, okay. Let me tell you, the price of Jardine's over 2,000, about 2,100 and something dollars.
It's expensive. Now, let me see those drugs. I
Yeah.
thought I wrote them down here. The Medicare negotiated on some of the high cost medications. It's Xarelto, Eliquis, Januvia, Jardiance, Enbrel, and that's for 2025. So what he brought up is actually true. They're going to look at for 2025. Okay.
The top,
Those are the-
10 expensive.
Yeah,
drugs,
those are
yeah.
the ones that are most common. Yeah, absolutely. All right, so let's move on a little bit here. Talked about the Inflation Reduction Act. You got your max amount of pocket this year for the first time. Now, what's going to happen there? I'm getting a lot of calls from members right now saying their drug plan is doubling in price. The answer to that is that they're doubling in price because there's a max amount of pocket. They've got to absorb some of that cost somewhere. If your drug plan is still low premium, it's probably not designed for brand names. If it's going to have a higher premium, it's because maybe you need that drug plan to cover those brand names. Okay. So I've seen one going from $29 up to $65. That's a huge increase. What I would suggest, if you have something like that, look at the plans. Call us, go on the Medicare site, or call Medicare or call SHIP. Find out if that's the best plan for you or not, because that's a big increase. And if you don't need that kind of plan that's expensive, there are other options out there. So keep that in mind. I did mention legal aid of Bluegrass. They do help with Medicaid, Medicare help. They also help with manufacturers. Talking about the high cost of these medications, if you qualify income-wise, you might get help. Now, you may not get Medicaid. You may not get extra help. Extra help is low income, but not Medicaid extra help. And you still might get help from the manufacturer. Okay. So the SHIP office has a program to help you look at that and help you with getting that drug cost lower through a manufacturer. So that is possible to do that.
Well, my income's so high, my income's so high, they reduce my social security check every year.
Yeah, well, that happens. So
I'm making money.
it's good. All right. So just remember, if you're eligible for Medicare, you definitely want to get it at the right time. There is penalties for not getting Medicare. Part B has a 10% penalty. I'm sorry, Part A has, no, that's it. Part B has a 10% penalty and Part D has 1% penalty. So I don't think Part A would actually have a penalty. You're eligible for it for free. You can get that. But Part B, there's a penalty if you don't get it the right time. Sorry there. If you're still working, you don't have to get Part B yet. You can use your employer plan. But once you're eligible for Medicare, you don't have an employer plan, you definitely want to get on Medicare. Okay. Or retired, obviously. Yeah, absolutely. So a couple of things. Picking the right Medicare plan. I know we talked about earlier, Chuck, we talked about these phone calls that you get, either they're spam or telemarketers, or
Tell me about
you get mail coming in every year from people. I don't even answer spam calls. I get them too. But I don't think
you get.
I don't think people are at your best interest when they're just calling you. They don't know you. They're not sitting down talking about it. I feel like some of these calls, they're selling you a benefit that might benefit you, but you have to look at the whole entire plan. Just because it provides you groceries, just because it provides some dental coverage, overall, is it the right plan? So you want to make sure you're looking at everything. I think the government is starting to crack down on these companies where they have to record phone calls. And if you ever change plans and you have a complaint, you can file that, they have a phone call that's supposed to report it and go back to that phone call. How did they sell your plan to you? And if you got the wrong plan and you want to get out of it, Medicare allow you to switch plans because you weren't told all the information. So be aware of that. Try not to answer those calls. It's better to work with a local agency like us or talk to the SHIP office if you'd rather go to them.
That's why I've been telling people. I said, I told a couple of people, I said, if you want to take my advice, some guy from New York got me on Humana. And then I think he sold my name to everybody around there as a nonprofit. That's why I get all the calls. I told one person, I said, when you get that book from Medicare, go in the back of it where it shows you the listings of the local area.
I think you brought up a good point, though. When he's talking about the your number being sold by multiple companies, that is very true. If they have your number and you tell that person not to call you again, your number's probably been sold already several times. So it's best not to even answer them.
And I told him, look in the back of the book for your area.
Yep.
And look under those toll-free numbers right there for those.
Charles brings up another point. I think that Medicare The Medicare and U book will come out in the next,
Fall in.
yeah, the Medicare and U book will come out the next month. And it will have all the different plans available in the back of the book. So that's a nice thing too. Have anybody got their Medicare and U book yet? You did get
No,
it?
I haven't.
2024 book?
My mailbox.
Got mine today.
Oh, okay. Great. Great. Okay. All right. So 4 things to think about when you get your Medicare plan. It's not just the premium. It's not about the premium. A lot of them are 0, right? Almost all of them are 0. There's a couple of them that have premium. If you see a premium on a plan, it's because maybe they're going to have lower copays, because they're going to have a lower max amount of pocket. So the advantage of an advantage plan is not only does it have extra benefits that might be beneficial to you, they have a max amount of pocket. Medicare doesn't have that. So it's not just the premium, it's not just the extra benefit, it's the whole package, like I mentioned. Think about that. When you pick a plan, look at their formulary. Is it the right formulary for you? And does the copay cost going to be good? The tiers. I've seen some companies last year or for 2023, they covered Eliquis, but they moved it from a tier 3 to tier 4. And that's huge. That's huge difference in cost. So you got to watch out with these drug plans if they're going to change their formula, change the tiers next year. So think about that. When I'm talking with clients, this is a good one here. I found this is a little list I found online. These are 4 things I found, and I really like this one. Which benefits are most important to you, right? So if I'm meeting with a client, I'm trying to figure out which plan's right. All these plans are going to have about the same benefits, but they're going to have different cost or different share cost. If it's more important for you to have dentures and implants, you want to get a plan that covers that. Just because the plan has dental doesn't mean it's going to cover implants. If you're looking for a plan with low cost on hospitalization or a low max amount of pocket, you want to pick the right plan that matches up for you, not just what matches up for your best friend or your neighbor, what's best for you. Okay. And the last thing is kind of what I've been talking about the whole time I've been talking up here is take time to understand Medicare. Take time to understand these plans. If you don't, ask an agent, ask a person at SHIP office. The Medicare Advantage plan is the all-in-one, the no premium copay plan with these extra benefits. The Medicare Supplement plan is another product where you're paying a monthly premium. So when we mentioned the plan G earlier, you're just paying a monthly premium each month, but you have an annual deductible once a year. So if that's a better fit for somebody, then that might be the way to go versus an advantage. So talking about these differences and find out what's right for people, you want to get a plan that's right for you. Okay. And if y'all have more questions, we'll talk about that at the end here. Couple of things here. Annual notice of change. I just want to mention that one more time. The insurance company is going to send you the changes for next year. Now, one of my clients got their changes, and that's all they got was the changes. I was really upset about that. I'm like, why are they sending just the changes? They used to send it where you get the changes in the front and the back of the book that tell you all the benefits that you have. Because sometimes you're like, okay, this changed, okay, but what about how much is physical therapy? How much is the chiropractor? It's not mentioned as a change, but how much was it? You don't remember exactly what your benefits are every year. So that's kind of upsets me a little bit. So if you're with our office and you want the full benefits, I can email you that, you can have it. But one of our clients said, hey, I noticed a chiropractor is not covered. It says not covered on here. Well, it's actually covered. But they had a 0 cost chiropractor visit if it was routine, and they had another chiropractor visit that was $20. Well, the $20 one's still covered, but the 0 cost one went away. But it looks like on the notice of changes that this chiropractor no longer covered. So it's interesting how they did this. And I hope this is the only company that's doing that. I hope all the other companies would send the changes plus what the benefits are on all the benefits. What is the outpatient surgery? What is an MRI? What are all those things that you want to refresh your memory? So that's Medicare Advantage. They should have a list of summary benefits of what all the copays are for that plan. And they should also have the copays for your drug coverage as well. I think I talked about this earlier. They're going to crack down on misleading marketing schemes. When you see a commercial on TV and they say you're going to get $164 back on your Medicare, guess what? They're not available in Kentucky. Now, there are plans that give money back on your Social Security. It might be $50 or $100. It may not be the right plan for you, but the maximum in Kentucky, I think, is $102 I've seen. So they're not allowed to advertise a give back program in the state of Kentucky. It's not even available. You know, so they're cracking down on those things. I mean, was it Joe Namath and Jimmy J. Walker and all these folks on TV? They can no longer advertise if it's not available in your area. So they got to be more careful. So hopefully they're doing more than just that.
Well,
What's
see,
that?
those are
I said I
actual
want to see
commercials.
and Walker.
They'll be back. They'll be
They'll be
back.
back, but-
Maybe William Shatner this time. I don't know.
Yeah, really, exactly.
So just think about the things you're seeing. Hopefully it's getting better, that it's more clear. I've always told the insurance companies, when you're doing this renewal document, like I was talking about, send a brochure of the best benefits you have as far as why somebody went with that plan, like your extra benefits at least, and then put all the medical stuff where the medical goes. Because it's nice to see all these extras in one spot, but they're all over the place sometimes. I mean, I wish they'd make it simpler, but they don't always. Anyway, they're going to crack down on marketing misleading schemes. And that's what they wrote on here. I don't like the word scheme, but it's what's said here.
Does that include, radio?
Yeah, that's what it is sometimes. What's
Does
that?
that include radio commercials too?
Radio commercials.
Yeah,
I don't know if there's too many.
Yeah.
Is there radio commercials?
there's one that advertised, some type of health plan called the, Bible. Down.
I don't know. We're talking about Medicare. We're talking about Medicare, so I don't know about that. So
Some type of medical plan.
yeah. So guys, think about what you guys have and think about what if you do need to make a change this year. I do know that I've seen a lot of changes coming forth with these companies. We go to meetings with each company every year, and they talk to us about the different changes they're making. I think the biggest thing this year I saw was all these flex cards. Did anybody get a flex card with your Advantage plan? It paid for dental, vision, hearing aids, extra money. A lot of those things might be going away. They're not going to be as common this year, but a lot of plans will still cover a lot of dental. They're still going to cover vision and hearing aids. They're still going to cover the gym membership if you're using that, over-the-counter items. So if you're getting a plan with all these benefits, make sure you're using them because that's why you got it. And make sure if you're going to go to the doctor and you're supposed to pay a copay, make sure it's the right copay. So that's why that summary benefits is important. And like we were talking earlier about yours, if you're not supposed to have a copay, you don't want to pay that bill. You want to get them to fix it. You want to call the doctor's office and ask them to fix that diagnostic code because maybe you're not supposed to pay anything on that copay. Go ahead.
I'm with Anthem.
Mhm.
And I got a call this week that, Anthem is sending a nurse practitioner to my home Friday.
Okay.
And, I wanna know, they said that, I could have all my prescriptions put together and any of my lab work and, I wanna know, what, am I required to tell them anything?
Good question. So we have a lot of that with Medicare Advantage plans where they may call you for a health assessment and they also want to do a personal visit with you.
Yeah, that's call I got.
They want us to do the health assessments at the time of application. Sometimes I'll do this if I have time. I think it's two things. They're supposed to give more back to the member or help them with certain things, but also the Advantage plan is going to get more funding from the Medicare program if they find that you have an illness that might cost them more money.
Yeah.
Okay. So it is supposed to be twofold. They can get more funding if they find out you have a health issue that they might have to more expenses on. But ultimately, if you give them that information, they might be able to help you with some of the services. Like one of the things Humana is doing is if you have AFib, you're going to be able to get Eliquis at zero or very, very low cost. Okay. If you have COPD and you have Humana, they're going to give you inhalers at zero cost or very low cost. So I think that, and then we talked about Dexcom earlier. You know who mentioned that with the diabetic monitoring system? There are programs that will help you get that at no cost as well. So I think that it is to your advantage to do those if you can. And I don't think you have to do in person. There's no reason why they can't do it over the phone with you. But if you have time for them to come by your house and they want to meet with you in person, that's fine. It can be helpful. You can get some freebies out of our low cost things. They can provide you with assistance. So if you feel like that you're not getting some assistance that you would like to get, it's a value to you, do that. But if you say, hey, I got a great relationship with my doctor, I got everything I need, you can say no. I don't need you to come to my house and I don't need you to talk to me about my plan and everything's good.
Yeah, I don't want them to cancel me.
Yeah.
I don't want to say anything that.
No, and they can't.
Okay.
So Medicare Advantage plans never have health questions, ever. Okay. You can enroll them at different times of the year if it's an open enrollment period, but they never have health questions. Okay. So that's really interesting. If you're looking at a Medicare supplement plan, there's no health questions initially when you go on Medicare, but if you want to change from a Medicare supplement to a new one, generally you would have to answer health questions. So, but Medicare Advantage, you can tell them all you want. They can't cancel your policy and they can't deny you coverage of any kind. So,
Okay.
one other thing I heard about Medicare Advantage that's kind of a complaint sometimes is going from the hospital to like a skilled facility. They're trying to get away from saying, hey, because you have Medicare Advantage, this is going to take a lot longer. I wish the doctor, the person in the office says, if you would have Medicare supplement, you would have got to the skilled facility much faster. We're trying to get away from people saying that because sometimes it's true. They have to go through authorization. But what they're wanting to do is that make sure that everything that's under Medicare is also covered under the Advantage plan. You shouldn't have any trouble using your plan as you should. If you had a stroke and you went to the hospital and you need to go to skilled care after that, you need to go to skilled care. You shouldn't have to wait 48 hours, 36 hours to get to skilled care. So they're trying to make some improvements there. Now, I forgot one thing on here because I mentioned network earlier. Humana and Baptist Health. Anybody have Humana in this room?
Yeah,
Okay. So here's the deal with Humana and Baptist Health. They're having a contract negotiation. Baptist Health has already updated the website that they're unfortunately was unable to get that contract completed. My conversation with Humana is they're still working on it. They need to get it done by the 15th of October or people are going to start leaving the plan. Okay. There is a continuation of care form you can fill out with Humana if you're undergoing care and you want to continue that care. I had a lady come in yesterday and she was set on changing her plan because of this. She showed me her summary statement and she's hit her max amount of pocket. Her max amount of pocket, she spent a lot of money. It's $4,500 for the max amount of pocket on the Humana plan that she had. I don't want her changing plans. She's going to start with a new max amount of pocket for the last 3 months. So I said, you expect this to continue? Yeah, I got these health issues and I'm probably going to have to pay for my infusion. Okay. Look, we don't want to change your plan because you're going to start paying copays again and you have a new max amount of pocket for the last 3 months of the year. So I gave her the continuation of care form and she's going to get it filled out and hopefully she can continue with her care to the rest of the year. And then for January 1st, we need to look at changing plans. If Humana doesn't get this fixed, we need to get her to a new company that has the Baptist Health doctors and doctors that she wants. Here's the other thing. If you want to change plans immediately from Humana to another care that has Baptist Health, you can do that immediately. Okay. You can't do it because of a network dispute or contract. But in Kentucky, today we've had rain for the first time in probably weeks, right?
Yay!
But we've had windstorms, we've had flooding in certain counties, and the governor had said, if we've had a lot of things happen in Kentucky, we're going to make it a special election for the whole state, though. It doesn't matter if you're affected by the flood or the windstorms, you can change your plan. So what I'm telling people is, I can't change your plan because of that network with Baptist Health. But if you want to change your plan, I can use this weather-related change. We're able to do that. You don't have to be personally affected. As long as you're in the state of Kentucky, you can make that change.
Does that take you all of your co-pays and out of pockets to the new plan? Or do those?
No, you would actually, like, let's say you went to Humana to a new company. Whatever that new company has in co-pays, you adopt that new plan cost.
Okay.
But like I said before, if you hit your max amount of pocket,
Yeah,
you don't want to do that. You don't want to do that because you obviously got a lot of expenses going on. But I've had a few people say, you know what, Pete, I've got 3 appointments with Baptist Health in October. I really like to go into my plan change. It's hard to get these appointments rescheduled with these doctors. And I really need to get these checkups done because it's a revisit of a situation I had. No problem. We change it October 1st. It's almost the end of the month. You know, we could probably fit another person if we need to, a few people if I had to. If you change in October instead, it's going to be November 1st. I've actually encouraged most people to meet with me in October instead, because guess what? You can look at the new benefits for 2024. And then instead of making a change for January 1st, you make it for November 1st instead. And that way you get the plan immediately. Was there a question back here?
I have a question about,
Oh.
you said if a plan offers something, you should take advantage of it.
Absolutely.
So why is it, I mean, like, let's say they offer free chiropractor. Should we take advantage of it because it would be more benefit?
That's a hard one because some people have a lot of faith in chiropractors and some people aren't a big fan of chiropractors. That's a real personal decision. But you could visit one and see if it's beneficial for you. I mean, it's a personal decision there.
And then.
But if they're going to give you $1,000 for a flex card and you can get some dental work done and you maybe have a dental issue, you want to use that because at the end of the year, that benefit's gone. It's an annual benefit. Did you have another question though? No,
what-
back here. I'm sorry.
Well, I guess I need to find out what the things are that I can take advantage of.
Yeah, absolutely. Just, yeah, you don't.
Question a while back. And I know, I probably should have known the answer to this, but I've asked and it just doesn't seem like the logical answer. When I have Humana and of course Medicare, so I have Humana Medicare, but I don't know if I'm paying any kind of monthly thing for Humana. They seem to say you're not.
A premium, you mean? Monthly cost?
And I don't know how they can possibly do that because they do seem to give you a lot more.
Well, most plans have no premium. If there is a premium, what usually would come out of your Social Security check. If they do, you can check your statement. But here's the thing. Why do that's a good question you brought up. Good statement you brought up. Why do Medicare Advantage have no premium and no deductible? Does anybody know how that happens? Every Medicare Advantage plan gets funding from the federal government, Medicare. Okay, we all pay to Medicare as we're working, but since they created the Medicare Advantage program and they gave them inflation increases each year, well, that's how they can add these extra benefits. But there's no premium and no deductible because they're getting funding from the federal government Medicare every single month for each customer they have.
I'm telling you, so it really makes sense.
Not necessarily. Not necessarily. The money out of your Social Security check is for Part B. It's only $164.90. They're getting a lot more than that. They get a lot more than that. They get a large amount of money. Now in Florida, they get more money than we get here in Kentucky because there's more claims. There's more people, more seniors possibly in Florida. So when I look at hospital costs in Florida, it's usually lower than Kentucky because they get more funding down there. But it's all this funding they're getting. So if you go to the hospital on a Medicare Advantage plan, it says a $300 copay for outpatient surgery. That's all you pay is what the copay has. And the insurance company is going to pay the balance because they get that funding from Medicare.
Did
That's-
you get a
ser-
list from Medicare that gives y'all the options, what they offer each year?
Yes.
I don't get that.
You should get the Medicare and U book. It'll have the companies listed, and then you can go on Medicare.gov or go through an agent. You had a question,
Are
sir?
you aware that Kentucky retirement systems and school teachers and state employees I know Kentucky retirement systems with my mother received a letter yesterday that no longer Humana at all.
Yeah, I heard about that. They're affected as well. Yeah. So what I'll say to that is you never want to leave a program like that that's free because you work there, right? She pays no premium for that plan. You want to call them, and I don't know the answer to this question. You want to call them and say, what if we go out of network? Because those are PPO plans. HMO, you must use the network or it's not covered. Okay, that's important to know. But the teacher retirement program is a PPO. So she can still go to Baptist Health, but if it's out of network, what's the cost?
It actually stated that effective certain date that Humana was no longer connected.
Well, they're no longer in the network. You can still go if it's a PPO, but what's the out of network cost? Okay. Now I've got one Humana plan that some people call me on. They say, hey, Pete, I got this PPO. Can I still use it? I know PPO lets me go out of network, and there's one plan we have. The cost is the same in network and out of network. Only one plan. Most plans that we have, if you go out of network, it's 30% out of network. So it's not good. But on a teacher retirement program, it might be a lot less than that. So you might just find out by the benefits department.
She passed away, and so we don't have to make any changes.
Oh, well, yeah, yeah. So
But we do have a lot of families that are affected.
I would say they call the benefits department though and check. So did you have another question, Charles?
I just want to say, my doctor is in one of the buildings over at Baptist Health, but he's not a Baptist Health doctor. He's a UK doctor.
Yeah, I've seen that before. I've seen
So
that.
I don't have to worry about that.
Yeah,
but
okay.
I asked the same question about my sister about Humana, and she said, well, we hope they could solve the problem. I says, well, what about United Healthcare? Oh, we're still in good terms with them
Yeah.
at this time.
Yeah, absolutely.
Yeah.
So hopefully they'll get that settled by the 15th.
And the thing about the dental thing, I got the card. I went to the dentist in May, had a tooth taken out, and I asked the billing lady. She says, "Well, give me the card." So I gave her the card. She ran it through there, and she says, "Well, when you get your next statement, look and see if they're going to pay for it or not." So.
All right, Charles, got other questions. We'll talk about it later.
So I said, I think that in August and asked her, she
Okay.
said it was all paid for.
We got other questions. Gentlemen, you got a question back here?
I,
Go ahead.
oh, okay, getting back to Humana and Baptist Health.
Yes.
Okay, I got the letter, mine said my primary care would no longer participate with Humana.
Correct.
So of course that, blah, blah, blah.
Yeah,
blah.
yeah.
So I immediately called and then also called Baptist Health. They put us on the phone together
Yeah.
regarding that. Well, that date was the 22nd, which was this past Friday.
Correct.
So I filled out the document to send in to keep her as my primary care.
Yeah.
So I have not gotten a response. Now, I had 2 more appointments before the end of the year. One in November with the primary care, and I have one in 2 weeks with a neurologist that's Baptist Health.
Yeah.
Now, it did not list the neurologist in that document that I first got, not being with Baptist.
Well, let me help you there. All the doctors with Baptist Health are considered out of network currently.
Okay,
Now, you can use your continuation of care form, but that form is specific to chronic conditions. I don't think everybody's going to use that continuation of care
well,
with
when I filled
Baptist.
the document out and I did the basic stuff, on the other side with your different conditions, nothing qualified.
Exactly. So this is what I'll tell you.
Nothing there but other.
What I said before is true, that
Yeah.
if you want to change your plan, you can do it by the end of the month. You can do it in October. It could be effective October or November 1st. So if you can delay your appointments to November and look at your plans for next month, what the changes are, and change your plan, you can do that. With that weather-related change, we can help you do that, or our Medicare can do that for you.
But I
So,
never had any issues with Humana.
yeah. Well, good.
And
Good.
so I mean, I was pleased with them.
Good.
It's just that they just kind of took me by surprise.
Yeah, I think so for a lot of
I moved
people.
here from a different state, and I've been with the same primary care. But the
And like I said, yeah, if you want to keep your doctor, you definitely want to maybe change your plan when you
Okay.
can. So, and I guess got a text from my mother. She got her Medicare and U book too. I always ask my mother when she gets her Medicare and U book. Guys, I don't have much more time. I know sometimes we got some long statements and questions here, but if anybody has any quick, simple questions that want answered real quick before I leave and finish up today. Yes, I've got my business cards here. I can hand those out to anybody who needs one. And if you call my office and I'm not available, talk to any of the agents in my office. They can help you. Because I've been doing this for quite a few years and sometimes I get busy. So you can talk to other agents as well. We're all licensed agents in the office.
Okay, so let's give Pete a round. Thank you.
All right, thanks, guys.
We have a gift for you. It's not nothing really special, but it is.
Oh, well, thank you. Appreciate that. Excellent.
Later on.
Thank you very much. Thank you very much. Well, if you want anything, let me know, okay?
Hello.
Are you leaving now there?
Yeah.
Okay, all right.
You don't have any orders.
Food, we're doing the, some food distribution, if you signed up for that, we can bring it to you. Or you can,